Good afternoon. It's 8:38 a.m. Eastern Standard Time, October 23rd, 2020. My name is Anthony Werner. I'm the Chief Executive Officer and founder of Patients Advocate International. First and foremost, I'd like to say thank you to a lot of you who mentioned and made comments on my post, my video, regarding the situation I encountered yesterday. First and foremost, I'd want to apologize if it came off with angst or anger or just sheer frustration. I was just upset with the situation and I felt we need a call to arms to solve it, which is sort of why I'm making this video this morning, as to elaborate about what my company does and how we work. So again, Patient Advocate International, also known as PAI, is a nonprofit organization, does not charge the patient, and works solely on tips. We are a healthcare advocate company that help you with both clinical and non-clinical issues. Essentially, what we do is we help patients work with any diagnosis, diseases, or treatments, or screenings, or anything medically that they don't understand. And we also work through the healthcare benefits and the cost and planning and whatever else they need through the whole process. We're your support system through the whole system. That is what an advocate does. We work with doctors, healthcare facilities, and insurance companies, pharmacies, and what have you to ensure that the whole process is seamless to the patient and their families. They're not overburdened with red tape, and they can get the services they need. So what that means is, from a clinical side, is speaking with your physicians, understanding the type of care you're needing, understanding what they're doing, explaining it to you, explaining what the intensive care unit, critical care unit, coronary care unit, neurointensive care, surgical intensive care, telemetry, whatever unit you're on, whatever type of facility or specialist you need. We will educate you and to make sure that you understand what is exactly going on clinically so you feel well informed and can make decisions. If you don't understand something, we're there for you. We will speak with your providers and get a basic understanding to help it break it down for you. If you feel you're not happy and you want a second opinion or you need to be transferred, we will help facilitate that from start to finish with you. We will work with your providers. We are not anti-providers, and the message here is not to vilify healthcare providers, insurance companies, or anyone else in the healthcare field. The whole goal of everyone in the healthcare field is simple: to help the patient and their families. The problem is communication. Now, please, I don't want to make this a political conversation. As I said last night, whether you're Republican, Democrat, I could care less. With the election so close away, again, healthcare has been an issue, but that's not the issue that I want to raise with the politicians. I want to help people one person at a time, brick by brick, and help build us a foundation where Patients Advocate International, PAI, can be recognized as a company who is always there for their people, 24/7, 365. Now, we handle two types of issues. As I said, clinical, which is working with your healthcare providers, and we also handle non-clinical issues. Non-clinical issues is essentially working to break down that red tape. Red tape could be from insurance authorizations, like the young lady I saw last night, and making sure that people don't walk away from their medicines. They can get their medicines at a cost that's fair to them. They can afford to feed their families. They understand their healthcare benefits. We work with you to make sure doctors are in network, what their specialties are, what their training is like, what is the difference between a DO and an MD and an NP, nurse practitioner, doctor of osteopathy, medical doctor. We work with you to ensure that you're educated on the healthcare system because not everyone is. It took me 25 years to do it, and I'm still learning. So my goal for you is to ensure that you feel safe and that you have someone on your side who's willing to fight for you and work with whoever he needs to work with to get the treatment and understandings and get the red tape out of the way. I want your physicians and your healthcare team to focus more on working with you than rather having to deal with the red tape. I want to bridge that communication between the non-clinical and clinical team along with you as the patient and family to ensure everyone understands. Whether it's from making doctor's appointments or working with facilities, understanding what it needs to be paid, making sure the codes, the medical codes that they used are accurate, making sure the insurance company pays the claim accurately and it's billed accurately by the medical facility or practice. That is my goal, to go over that with you. And if you have a problem with payment, working with them to letting them understand that the current situation, especially with COVID-19 and the fact that so many people are unemployed, to not worry about whether I can afford food or I have to pay this medical bill. I want to work with you on your medical care and medical issues to where you can work with your family and be able to live a quality of life that you deserve. We live in the richest country in the world, one of democracy and freedom, one that my father fought for. It is my goal to help everyone get the health care that they deserve without sacrificing food, home, shelter, or their health care, or vice versa. Because they have to make a choice they shouldn't have to make. So if you look at my Facebook page, you'll see I've been very successful. Out of all the cases that I've had, I was able to work with a cancer patient to get her proper care. She's in remission. I'm beyond ecstatic. I work with preventative care patients to make sure they're billed correctly and the codes that are needed are correctly used. I ensure that patients who need a drug that costs more than they make and their benefits don't cover it, get it covered through the financial avenues that are available to me. If somebody's in the emergency room or someone has a diagnosis and they need somebody to talk on their behalf, or they want to know why a test was or was not ordered, we're here for you. Our goal is not to second guess physicians, insurance companies, or healthcare providers or facilities. Our goal is to work with them and break down the barriers of communication and red tape so medicine and healthcare could be seamless and patients can get taken care of quickly, fairly, and not feel that they're a number in the system. That's what PAI, Patients Advocate International, is. I'm available by Facebook. I'm available by phone, email. The first person you'll reach is me. I'm always available, 24/7, 365. I'm here for you, for your healthcare needs. The only ask of you, I request, is one thing. You share this message. You get the message out there. I'm not looking for notoriety, and I'm not looking to be famous, especially the way I look in jest. I'm here to effectuate change, to make change happen, to help. It starts with one person with a passion and a mission, going out there and working with the army of people to make change happen. I want to thank you for your time this morning. Please feel free to reach out with any questions, comments, concerns. If you'd like to help, I'd be more than happy to work with you. If I haven't worked with you in the past, it'd be my pleasure to meet you and work with you. If I've worked with you in the past, my pleasure. If you need me, I'm here 24/7, as I said. I wish you all well, happiness, love, prosperity, and thank you for your time this morning. Anthony Werner, have a nice day.